Good afternoon and welcome to the media. His Excellency the Governor, Mr. Martin Roper, Premier the Honourable Alden McLaughlin, Minister for Health the Honourable Dwayne Seymour, Dr. John Lee, Chief Medical Officer, and Medical Officer of Health, Dr. Samuel Williams Rodriguez, and of course to you, the viewing public and the listening public, to this, the latest update on COVID-19.
Hello everyone. Yesterday we held a press conference here to apprise the country of what the government had been doing over the course of the last many weeks in terms of preparation for COVID-19 and to update everyone on the status of a number of tests which had been carried out with respect to the disease. As we indicated yesterday, we plan to hold fairly regular press briefings. We know everyone is concerned, everyone is worried, and it is important, we know, that we continue to communicate with the broader public about the measures that government is taking, providing guidance on how people should conduct themselves and providing information relating to how we can best control the spread of this disease in Cayman. So over the course of today, there have been a number of discussions. We've had a meeting of Cabinet which has just concluded, and Cabinet has taken some key decisions which I wish to share with the country. The first is that we have decided to add a number of countries to the travel restriction list. These include Iran, Japan, Republic of Korea, and all Schengen visa countries, essentially all of the countries within the European Union. On the list previously, of course, was mainland China. We have also decided to ban all cruise ship visits with effect from Monday the 16th of March for 60 days. All educational institutions will close from Monday, March 16th to April 27th. With immediate effect, there will be a ban on all public gatherings over 50 persons until further notice. There are also a significant number of other important decisions which are under consideration as the threat of this virus becomes even more grave. As I've said before, some of these decisions are quite radical and drastic, and indeed some of those that we will have to make next week, maybe even more so. But we are determined to do everything we can to reduce the chance of widespread transmission of the virus through the community. Overnight and this morning, I'm sure everyone would have learned of the situation which has developed at Health City Cayman Islands. They have put out a very comprehensive statement. I do not intend to add to it, but we have the two medical professionals here, the Medical Officer of Health and the Chief Medical Officer, who would be able to answer any questions that the media may have regarding the arrangements that have been put in place with respect to Health City.
Thank you very much, Premier. I mean, I recognise very much that having a confirmed case of COVID-19 and the situation at Health City is a matter of great concern for everyone. But this was not unexpected, and government has been putting in place measures to minimise the impact. And I strongly support the tough action that the government is taking around public gatherings, educational institutions, and travel restrictions. It's been shown elsewhere that you try and flatten the curve as this epidemic hits us, and that's exactly what the government's measures are aimed to do, to manage the load on our health services. I do want to say as well that we have excellent infrastructure and medical professionals in our islands, and we will come through this. We also have access to expertise in the UK, and I'm very pleased that a delegation from Public Health England, 3 people, will be arriving on island shortly to support us. This team includes a communicable disease control consultant, a consultant microbiologist, and a laboratory quality expert. And Public Health England have also been very helpful to us with some modelling about how these epidemics develop and what they might do, and they're also providing some personal protection equipment. And I do think it's very important that we will very soon, early next week, be able to test on islands. That's a really important development for us. I think now is a time for our community to come together. In Cayman, there's a strong Christian tradition of helping each other. The majority of us will probably only get mild symptoms if we get COVID-19 at all, but some will be more seriously affected, and we do need to look out for our elderly and ensure that they get the medical advice that they need. I am concerned about the panic buying that we've seen in the shops. I think that is completely unnecessary. Our supply routes are robust, and our ships and flights for now are operating normally. I also am concerned about our media and those on social media who have a responsibility to the community. The spreading of rumours, and let me be very clear about this, the spreading of rumours is totally unacceptable when we are dealing with a situation like this. And I would encourage all members of the public only to get their information from official sources. And if necessary, we will use the law to tackle those who spread false rumours. So please do act responsibly, and please support our medical personnel and other officials as they work to help us all. So finally, I think we should all remain calm and continue to the extent that we can based on the restrictions we're imposing today. We should carry on with our day-to-day lives, and we should follow the expert advice from HSA and our medical professionals. Thank you.
Good evening, everyone. This is a very serious time in our country, and we need to work closely and together on this. We are in an unprecedented, if I may say, time, and our intent is to contain the spread as quick as possible, hence the reason for such drastic measures. We can start testing as early as Tuesday, I'm informed, and this is welcomed news. I know some have been trying to dial the flu hotline and have been unable to get through, but we have been busy with calls, hence the reason it's ringing out. We have now decided to open a call center, and this command center will be open for 24 hours. We ask persons to cancel their travel plans and remain on island. As mentioned, cargo and goods will be still coming in, so no need to worry about this. We may move to having additional measures in terms of protecting our ports, our airports, and we will monitor the situation to see when we need to move to that step, possibly protecting our borders before persons even get on board of our airplanes. We may note also that Belgium, the Czech Republic, Austria, Slovenia, Germany, Spain, the USA, Canada, France, all have bans on public gatherings. I want to thank the Public Health, the HSA, HCCI, doctors, hospital, all medical professionals, the Ministry and Hazard Management for all the hard work that they're doing, and along with Cabinet. I thank you.
I didn't have any specific, I can answer questions. Yeah.
Okay, all right, we'll move into the question stage now. Members of the media, if you have a question you'd like to ask the panel.
Good afternoon, everyone. Reshma Raghunath, Cayman Compass. Premier, you talked about extending the ban, and you've named a couple of countries as well as the list. But we haven't heard the Caribbean countries. We have Jamaica that has reported overnight 8 cases. Is Jamaica being considered for that ban as well? And additionally, we had cases in Cuba that have also been announced. Can you tell us if those 2 countries have also been under consideration given their proximity to the Cayman Islands?
All countries are, quite frankly, almost all countries in the world are under consideration. Today, we took the decision to ban, it's not a couple countries, all of the EU countries are on that particular list.
Except the UK, I think we need to.
The UK is no longer part of the EU. I'm governor of the United Kingdom. They took that decision. So the UK is still, there is no question in our mind that there are threats posed by traffic between the UK and Cayman, indeed the United States and Cayman, as well as Jamaica and Cayman. Those are the principal sources of people who come here. So those things are being very carefully considered. And I do fully expect that early next week, we will be taking further action with respect to the airport in particular. We are thinking very carefully through the implications of some of the decisions we have to make there. The decision with respect to the EU and the other countries is a much easier decision to make because of the lack of trading, of trade and traffic between Cayman and those jurisdictions. But we have to be very careful about how we shut down contact with the United States and the UK and Jamaica in particular. And so those things are being worked through at the moment.
Premier McLaughlin, the public is asking if you could repeat the dates for the school closure from Monday the 16th to...
All educational institutions, and I say that because it's not just schools. It will mean UCCI, it will mean the Truman Bodden Law School, it will mean ICCI, it will mean all educational institutions where there would be a congregation of significant numbers of people or children. So with effect from Monday coming, which is the 16th of March, to the 27th of April, schools are, educational institutions are closed.
Another question from the public. They're asking if the 50 persons in any gathering ban relates to supermarkets.
No. Exempted are, I should have said that, exempted from the congregation, from the restriction, are hospitals, supermarkets, and pharmacies. All other institutions are subject to the ban. Bars, restaurants, churches, football games, sporting activities, everything. Because it's very tempting to say, well, essential, places where essential services or goods are provided should be exempted. But if you are a carrier of the virus, whether you are going to somewhere to buy gasoline for your car, or you're going to church, or you're going to a restaurant for a meal, you are just as contagious as you would be otherwise. So the objective is to limit as far as possible the congregation of significant numbers of persons, because it is the density of people within a particular environment that increases the risk of transmission of the virus.
I have one more question from the public. They're asking if they're away right now and they come home in the next few days, should they put themselves into isolation, symptomatic or not?
Well, I don't think we would discourage isolation. If you come from just about any country in the world now, you have there is a risk that you may have contracted the virus unknowingly. But certainly, if you are symptomatic, we want you to present so that and make the authorities aware that you are not well, so that the appropriate measures can be taken. And Dr. Lee, if I'm getting any of this wrong, please correct me.
That sounded pretty good, sir.
Yeah, I just want to add to that to call the flu hotline and also contact the HSA and the public health department for this type of individuals, or the individual that return from any area basically right now and start having symptoms.
And that flu hotline number, I believe, is 1-800-534-8600.
That's correct.
Okay, thank you. Any more questions from the media?
Yes, I'm sorry, I have a question, possibly Dr. Lee, you could be the one to answer this one. So we had a Cayman Airways flight today that we had one passenger or maybe more passengers that were taken off because of medical situation, which is still unclear, and I don't want to fearmonger or be subject to the laws, as the governor says. But can you provide us with an update on that flight, the passenger, the passengers, what happened with that particular flight?
Yeah. Well, the public health department was made aware of the particular flight, and one of the passengers in that flight exhibiting some symptoms that they thought they would be compatible with an infection. We deploy our staff to the airport. All the passengers were advised. A specific group of passengers we were interviewed and given advice. And the particular patient, I don't want to go into many detail, was assessed at the HSA. And I spoke personally with a physician who assessed the patient. And this particular patient, her symptoms are not suggestive of coronavirus.
So has that patient been placed in isolation, and the passengers on board, what have you done with those passengers and crew, of course?
So I cannot give you too many details, but the person that need to be placed in isolation, they have been placed in isolation.
So what about the other passengers then? Because the public is asking these questions as well. So
Again, without giving
assist me
you
with that.
too many details, there is a large amount of the passengers that have no interaction at all with this particular passenger. They have been advised to continue with their lives. They have been given an alert card to contact the public health department if they develop any symptom, or if they need to discuss also the flu hotline.
Okay, thank you very much. Now, the Premier mentioned the overnight developments with Health City and the staff at Health City. We did hear in the press release 10 staff members, but also in that same press release, around 30 staff members would have interacted with this positive patient. Can you give us any sense of what the operations are like now at that hospital, and if there are any protocols that have been implemented to reach out to patients who would have visited the facility since February 29th, and the visitors who would have gone to that institution during that time period before we got this positive test result?
I'm afraid I can't speak on behalf of Health City. I'm sorry there isn't somebody here to represent them, but so it's difficult for me to answer all of your questions, but I would only reiterate the facts that I know well, that the hospital is functioning with the staff that it has. The staff that are symptomatic have been isolated, but those that are not symptomatic continue to care for the patients that are there. A development that I don't think is in the public domain, until His Excellency announced it, was that there's a public health team coming. We've been in contact with Public Health England throughout the night to get the best guidance we can about how to manage the situation, and so we are following we're following their advice, which was actually concurred with the advice that was available locally. So the reason to request that Health City isolate themselves in the way that we have is as a result of that advice. They will be able to assist us. It's quite complex to go through each case, because you have to go through each case, each patient, each member of staff individually to make a decision about what the next step is for that particular person. It's not something you can make blanket across the whole organization, but the first responsibility will be to make a determination about the people who are due for discharge and how they can be safely discharged back into the community. For anybody that's been in contact, I've had some inquiries on that matter. and the information would remain as if you might have met somebody, as if you might have travelled, so that if you have develop any symptoms, please isolate yourself first. After that, contact your healthcare provider or the flu hotline to seek further advice, but isolate yourself and your family first of all, please.
Any further questions?
Can
We
I
do-
continue? Or do you?
We have a few from the public, if we could just, I'll get to those real quick. Someone wants to find out about prescriptions, they're concerned about access to prescriptions, as well as does the ban relate to restaurants, which may have over 50 people? And then the other one is about mortgages, light bills, and water.
May I tackle
yeah.
prescriptions?
Sure.
I don't know if you're able, Donna, to develop that question a little bit.
Basically, they have concerns about access. How will they access? Is there enough medications to be accessed?
We don't currently have a problem with our store of medications. I also understand that a lot of the, certainly some of the insurance companies are allowing a larger supply to be issued in order to save people journeys, to try and reduce the number of trips they have to make. And we're going to be trying to encourage that. That is an action item for the National Emergency Operations Committee in order to try and reduce the number of visits.
As it relates to restaurants, Premier?
Yes, it absolutely applies to restaurants,
Okay.
as it does to everything else except hospitals, supermarkets, and pharmacies.
Any more questions from members of the press?
Yes, if I can, please. Now, I think a big question on a lot of people's minds is what will we do when it comes to Carnival? Have you taken a decision on cancelling Batabanu and Kemas?
If they can have a carnival with 48 or 49 people, then it can go ahead. Otherwise, it's banned as a result of the decision we took today.
Until
Yes.
further notice? Until further notice?
Until further notice.
Yeah, so the decision to specifically announce a ban on carnivals wasn't even necessary because of the ban on public gathering, less than 50 people.
I get that, but of course the question still will be asked if
Yes.
that doesn't apply to our largest tourism draw, right? Or one of the largest tourism draws.
But if that carnivals will be canceled,
Thank you.
is the answer.
Okay,
Yes.
great. Thank you. If I can, Governor, you mentioned, and it is a situation that we here at Compass are also experiencing, having to find ourselves responding to rumors and clearing up all the allegations and the crazy stuff basically that has been flying around. Now, you mentioned that you will be taking consideration in terms of the law. Can you explain what you mean by that?
Well, it's just simply to say that spreading false rumours is against the law, and where we have evidence that that is happening, we will be asking our law enforcement agencies to investigate those matters, and if we need to take people to court for this, and that is something that will be considered, because I think everybody has a duty to behave responsibly, and that's at all times, but particularly at a time like this when we're dealing with a lot of very genuine concerns from members of the public. So I would just appeal to everybody out there to be responsible and have this uppermost in their minds, that you're playing with people's fears and concerns at a very stressful time. And I wanted to emphasise it because I do think it's a message everybody needs to hear.
I just want to say, sorry.
I just wanted to add that, and to encourage people to pay attention to the official sources of information. We are doing our very best, starting yesterday, to hold a press conference or press briefing every working day. And obviously, if there is some development which we think warrants us convening on Saturday or Sunday, we'll do that as well. But it will not always be the governor, myself, and the minister here, but we are determined to ensure that the public has access to the right information on a timely basis. And a big part of that is to ensure or to try to dispel the many rumors and malicious things that are being said and done, most unfortunate. But if you pay attention to the official sources of information, you won't go wrong.
What I wanted to add to that was all day long ministers of cabinet and members of caucus are trying to play catch up with these false rumors, and it's causing a bit of a problem in terms of us getting out to you, the media. We should have been here 3 hours ago, but we're constantly having to outfires and correct false information to try to calm the fear of people all day long. So it's actually tying up our ministers and MLAs if that's their intent. The people of this country needs us to work as efficient as possible and as quick as possible to get these things done to protect the lives of our citizens.
If I could make a comment on that point, a health comment. Please, everybody, this has been a really stressful week for everybody. Everybody is scared. A lot of people are really scared. Take some time this weekend. Calm yourself. Enjoy your beautiful islands. Let the stress, feel your muscles in your face, and let the stress come out of your muscles in your face, and you'll feel that calming sensation wash over the body. And withdraw a little bit from the social media. Don't watch everything. You don't need to. The trusted sources will give you the information you have to have, and that calmness will help you to relax and to face the next week better.
Thank you, Dr. Lee. I have 2 final questions from members of the public. One relates to hospital beds. What is our capacity for hospital beds now without Health City?
Yeah, so the issue about hospital beds, I wouldn't really see it like that. I would just see the Health City often run at fairly full capacity, just as the Health Services Authority runs at fairly full capacity. So it's just going to be full for a while. This matter is a lump. It could have happened to any of the hospitals on the island. It just has happened, unfortunately, to Health City. So we just need to help them through this. The hospital will be deep cleaned and it'll be back and ready for operation over a period of a couple of weeks, hopefully. So our capacity remains more or less the same, but the patients will be staying where they are in that agency. Because of the emergency situation, I know that the 2 remaining hospitals are ramping down their elective work, so that will immediately give us a little bit of increased capacity should we need it, because of the fact that the beds are locked a little bit at Health City.
The final question relates to, again, the ban. Premier McLaughlin, persons want to know how this will affect workplaces, particularly those that have over 50 people.
Right, so the ban doesn't affect workplaces. Employers, including the Cayman Islands government, are going to have to make some decisions themselves about how they run their operations, whether they impose shifts or staggered work hours to reduce the number of people who are in close contact to each other during any given period. And that is an eminently sensible thing to do, because if someone gets sick within the workplace, you don't want to expose all of your employees to it. Mm-hmm. So going to a shift system or a staggered work system reduces the chances of that actually occurring. And all of us have some big decisions to take. Certainly the civil service and public service have some big decisions to take about how we manage going forward. For this, we're going to be in this for 2.5, 3 months. So we're not going to just go home one Friday and the weekend is over and the threat is behind us. This is going to be around for a while. So I've talked to a number of businesses and business people, and I know many of them have business continuity plans in place. Some people have already sent staff home with laptops to work from home for extended periods. That's not possible with all businesses. We understand that, and it is going to pose challenges. But we just have to try to work through them the best that we can. We are in completely uncharted territory. This is like a hurricane that has a 3-month duration. You know, it's like preparing for that and dealing with the consequences of it.
Likewise, the churches, we've already had communications that some of the churches plan to stagger their sermons, 1:9, 1:10, 1:11, etc., for those large congregations.
Okay. Any final questions from the media? We'll wrap up.
Yes, thank you. If I can squeeze 2 questions in, just to build off the point that you made, Premier, about workplaces, does that also include construction sites? Does the ban relate to construction sites, or they're free to continue?
No, workplaces are not public gatherings, so they are workplaces. So as I say, employers are going to have to take some decisions about what is in the best interest of their staff, but which allows their business to continue.
Okay, and my second question, and I'm sure my friends on the sister islands are clamoring to ask this, what is the situation in terms of domestic air travel? Are you going to be considering stopping flights so that you keep the disease spread, the virus spread within the confines of Grand Cayman? Is that part of your consideration at this time?
No, we're certainly not going to shut down the air bridge between Grand Cayman and the sister islands. We put them in complete and utter isolation. This is one country. So even if we were to move to more radical measures with respect to the airport, we would ensure that inter-island flights and medevac continue to be available.
What kind of systems do you have in place for those on the sister islands in terms of their own health care, the emergency health protocols? Can you enlighten us so that we inform those residents as well?
I could make an effort, but I think Dr. Lee.
Yeah, but I don't think that, they won't have changed. Our inter-island transport, it remains. So the provision that we have currently for people who need to come to Grand for whatever reason, it will still be able to do so.
And the healthcare situation on like Faith Hospital, the preparedness, can you just
I don't know
give
if
us some
Dr. Williams
indication
can
on
take
that?
Yes, the Cayman Brac Faith Hospital have been is prepared actually, and they have allocated a flu clinic, also an area to admit patients with flu-like symptoms, and any patient that need to be transported to the Cayman Island, we already have arrangement with both Cayman Airways and the police helicopter to bring this patient to the Cayman Island, the patient that need intensive care.
One other person is curious as to the part of the HSA that was supposed to be ready for to quarantine persons if necessary. I want to know where we're at.
Yeah. Well, the first, let's clarify that the HSA is not a quarantine facility. The HSA will be to treat patients. The flu clinic separated from the rest of where it's now. It will start on Monday, and we're also preparing an area for patients that need to be admitted and treated, but not for quarantine.
I would, if I could maybe add to that, because I think it's a nice fact. This morning I was being questioned by Public Health England about what steps we had done in order to try and mitigate the effects. They said, have you set up a hotline? Yes, we have. Have you set up a separate clinic? I said, that will be there on Monday. Have you been given public advisory? I said, yes, we have. Everything they asked, we have been doing. So they were very pleased with the progress that we had made in this regard.
Sorry, we had a question that came in about going to the beach. I mean, I know, Dr. Lee, you mentioned that, taking some sun, sea and sand, but in a situation like this, is it okay to just go to the beach?
Yeah, going to the beach, people just need to be sensible about their public appearances and just keep their distances, the 3 to 6 feet that we mentioned.
Okay, if there are no further questions, any further comments from the panel? Everybody's good? All right, well, we thank everyone.
The only thing I'd say is that early next week, we expect to be making some further announcements with respect to further decisions the government has taken. We hope that there are no other adverse developments over the course of the weekend. And I take the opportunity on behalf of His Excellency and the government as a whole to wish everyone well over this weekend. We know it's been a very stressful week, and we have a lot more challenges ahead, but we will come out the other end in really good shape. I am very confident about our ability to manage what is a global crisis. I think we have the infrastructure in place. I think we have the personnel in place, and the size of Cayman, the relatively small size of Cayman, is a huge advantage when it comes to dealing with these issues. So again, I thank everyone for your many messages. I've been receiving them here, and as have my colleagues. And we thank you for your cooperation and your willingness to listen and to assist and to help us get through this very difficult time.
And I'd like to say thank you to the media, of course, to the listening and viewing public, to Premier McLaughlin, Your Excellency, as well as Minister Seymour and Dr. Samuel Williams Rodriguez and John Lee for joining us here for this update on COVID-19 here in the Cayman Islands.